Bismillahirrahmanirrahim. Assalamu alaikum. My name is Sayyid Mohammad Shairur Rahman. My roll number is BP165220 and my group is 56. The topic that have been assigned to me for the presentation is Parkinson's disease. So what is Parkinson's disease? Parkinson's disease is a progressive nervous system disorder that affect the movement. Parkinson's disease is caused by a loss of nerve cells in a part of the brain called substantia nigra. Nerve cells in the part of the brain are responsible for producing a chemical called dopamine, which acts as a messenger between the parts of the brain and nervous system that helps control and coordinate the body movement. If these nerve cells die or become damaged, the amount of dopamine in the brain is reduced. This means the part of the brain controlling movement cannot work as well as normal, causing movements to become slow and abnormal. The loss of nerve cell is a slow process. The symptoms of Parkinson's disease usually only starts to develop when around 80% of the nerve cells in the substantia nigra have been lost. Although Parkinson's disease can be cured, medication might significantly improve your symptoms. What are the causes of the Parkinson's disease? It is not known why the loss of nerve cells associated with the Parkinson's disease occur, but it can be due to genetics. Parkinson's disease can run in families as a result of faulty genes being passed to a child by their parent. It could be due to environmental factors such as pesticide, herbicides used in farming and traffic and industrial pollution. It can also be drug-induced, in which certain medications such as antipsychotics medication when taken may induce Parkinson's disease. What are talking about the symptoms? Symptoms include tremor. A tremor or shaking usually begins in the limb, often your hands or fingers. You may rub your thumb or forefinger back and forth, known as pill rolling tremor. Slow movement, also called bradykinesia. What is bradykinesia? Bradykinesia refers to an overall slowness in initiating a movement. Over time, Parkinson's disease may slow your movement, making simple tasks difficult and time-consuming. Your steps may become shorter as you walk. It may be difficult to get out of a chair. You may drag your feet as you try to walk. Rigid muscles. Muscle stiffness may occur in the part of your body. The stiff muscles can be painful and limit your range of motion. Impaired posture and balance. Your posture may become stooped, or you may have balance problem as a result of Parkinson's disease. Loss of autonomic movements. You may also have a decreased ability to perform unconscious movements, including blinking, smiling, or swinging your arms when you walk. Speech changes. You may speak softly, quickly, slur, or hesitate before talking. Your speech may be more of monotone rather than have the usual inflections. Writing changes. It may become hard to write and your writing may appear small. Now here you can see a mnemonic for the symptoms, that is tremor, rigidity, akinesia, and posture balance. Talking about the management and treatment, there is currently no cure for Parkinson's disease, but treatment are available to help relieve the symptoms and maintain your quality of life. The treatment includes supportive therapies such as physiotherapy. A physiotherapist can work with you to relieve your muscle stiffness. Speech and language therapy, in which you can improve your speech and language. Diet advice for some people with Parkinson's disease. Making dietary changes can help improve some symptoms. Talking about the treatment, because the salient pathophysiological features of Parkinson's disease is the progressive loss of dopamine from the nigrostriatal tracts in the brain. Drug therapy for the disease is aimed primarily at replenishing the supply of dopamine. This is accomplished through one or a combination of the following methods. Number one, administering exogenous dopamine in the form of a precursor such as levodopa. Number two, stimulating dopamine receptors within the corpus luteum through the use of dopamine agonists such as pramipexole and ropinirole. And third one is inhibiting the major metabolic pathways within the brain that are responsible for the degradation of levodopa and its metabolite. Now, to further investigate, we have a further investigate Parkinson's disease. We have a case study here. Let's go through it. LM, a 55-year-old right-handed male artist, presents to the clinic complaining of difficulty painting because of unsteadiness in his right hand. He also complains of increasing difficulty getting out of chairs and tightness in his arms and legs. His wife claims that he has become more forgetful lately, and Elam admits that his memory does not seem to be as sharp. His medical history is significant for depression for the past year, gout, which currently requires no treatment, constipation, benign prostatic hypertrophy, and aortic stenosis. On physical examination, Elam is noted to be a well-developed, well-nourished man who displays a notable lack of normal changes in facial expressions and speak in a soft, monotone voice. A strong body odor is noted. Examination of his extremities reveals a slightly ratchet-like rigidity in both arms and legs, and a mild resting tremor is present in his right hand. His gait is slow but otherwise normal, with a slightly bent posture. His balance is determined to be normal with no retropulsion or loss of writing reflexes after physical threats. His genitourinary examination is remarkable only for prostatic enlargement. The remainder of Elam's physical examination and laboratory studies are within normal limits. Talking about the SOAP notes that are the subjective objective assessment plan. The subjective notes are the gender of the patient is male, his age is 55 years old. He complains of unsteadiness in his right hand, tightness in his arms and legs, and memory does not seem to be as sharp. His medical history indicates depression for the past years, gout, which currently require no treatment, constipation, benign prostatic hypertrophy, and aortic stenosis. Talking about the objective notes, there's a lack of normal changes in facial expression, ratchet-like rigidity in both arms and legs, a mild resting tremor, and a slightly bent posture, and a monotone voice. The assessment we make from the SOAP notes is that Elam presents with many of the classic symptoms of Parkinson's disease. A noticeable unilateral resting tremor is present along the decreased manual dexterity, as evidenced by his difficulty handling a paintbrush. Rigidity or ratcheting of the arms, bradykinesia, that is slowness of movement, and a mask-like facial expression also are present. Although he has a partially stooped posture, it is difficult to attribute this entirely to the disease because postural changes commonly occur with advancing age, and on physical examination, his balance was normal. To confirm the diagnosis of Parkinson's disease, a therapeutic trial of levodopa may be considered. He also shows signs of autonomic nervous system dysfunction such as drooling, which is also called sialorrhea, seborrhea, that gave this strong body odor and the constipation. To treat, what is the plan of the treatment? Parkinson's disease can be treated either with dopamine agonists like pramipexole or the precursor of dopamine such as levodopa, but dopamine agonists are preferred in patients that are below 65. As Elam is around 55 years old, and his renal functions are normal, he started at an initial dosage of 0.125 milligram of pramipexole 3 times daily for 5 to 7 days. At week 2, the dosage should be increased to 0.25 milligram 3 times daily. Thereafter, his dosage may be increased weekly by 0.25 milligram per dose or 0.775 milligram per day as tolerated, and up to the maximal effective dosage not to exceed 1.5 milligram 3 times daily or TID. The titration period usually takes about 4 to 7 weeks depending on the optimal maintenance dose. Now concluding with notes and recommendations. Elam will certainly require levodopa therapy later as the disease progresses. By initiating therapy first with a dopamine agonist, rescue levodopa therapy can likely be started at smaller doses, and the onsets of motor complications that often occur with escalating doses and extended therapy with levodopa may be delayed. With the progression of disease, a combined therapy of dopamine agonist and levodopa carbidopa is started, adjusting the dose accordingly. At later stages, motor or psychiatric complications occur associated with levodopa therapy. To reduce these motor complications, COMT inhibitors can be given with a reduction of dose of levodopa. For psychiatric complications like hallucinations and depressions, tricyclic antidepressants or SSRIs can be used. Exercise, physiotherapy, and good nutritional support is beneficial at the earlier stages to improve mobility, increase strength, and enhance well-being and mood. Speech therapy and psychological support is often necessary in dealing with depression and other related problems. Newly diagnosed patients must be educated about what to expect from the disease and the various forms of treatment available. In addition, enlisting the support of the family member is vital in establishing an overall effective therapeutic plan. This is all from my side. Thank you. Hope you all have a good day. Thank you. Allah Hafiz.